This is Merrill Whitley in bed ER8. He is here with complaints of back pain. He is a 55-year-old Caucasian male presented to the ER with past medical history of hypertension, hyperlipidemia, and BPH, and past surgical history of appendectomy in his 20s and cholecystectomy in his 30s. Patient presents to the ER with complaints of pain while urination and severe back pain that radiates to his lower back. He describes the pain as if he is on fire, that his pain starts in his upper back on the right side and goes all the way down to his lower back. He also reports having to urinate all the time and burning when urination. Also reports nausea and vomiting for the last 2 days with loss of appetite. The pain has started about 4 days ago and it has progressively gotten worse, which is what brings him here to the ER. And that he can barely eat and sleep. He describes the pain as constant and sharp when he urinates. The pain gets worse upon urination. Nothing has helped relieve the pain. He has tried resting and taking ibuprofen with no relief. On a scale of 1 to 10 on a pain scale, he is at an 8 or 9 right now. Patient is currently taking lisinopril, torvastatin, and tamsulosin. No known drug allergies, no family history. He does currently live with his husband 15 years and he is a firefighter and he is up to date on his vaccinations. Review of systems, patient does present with a fever and he does say that he is fatigued. He denies weight changes, denies skin lesions or rashes, denies hearing loss, nasal discharge or sore throat, denies chest pain, denies shortness of breath. He does have some nausea and vomiting and loss of appetite within the last couple of days, but no change in bowel movements, constipation, or diarrhea, and he does have pain and burning upon urination. Denies leg cramps or history of clots. He does have pain in the upper right back that radiates to his lower back. Denies syncope, seizures, weakness, paralysis, numbness, or tingling. Denies bruises or bleeding, and no anxiety or depression. His blood pressure on his left arm was 125/80, blood pressure on the right arm was 124/82, respiratory rate is at 18, oxygenation is at 99% on room air. His temperature, he is febrile, he's at 101.3, and he is sinus tachycardic with 115 beats per minute. On physical exam, he seems to be a little anxious about his pain, but in no acute distress, and answers questions appropriately. Skin is warm, dry, and intact. No supraclavicular lymph node enlargements, no eyelid edema, no tenderness upon palpation. Sinus tachycardia on the monitor, no murmurs or extra hard sounds. Lungs are clear to auscultation. Abdomen is soft, non-tender, flat, positive bowel sounds in all 4 quadrants. He does have right costovertebral ankle tenderness, and he's able to move all extremities. My diagnosis for Mr. Whitley is acute pyelonephritis. I would order BMP, CBC, gonorrhea, chlamydia test, urinalysis, urine culture, and treatment plan for Mr. Whitley would be Cipro 500 every 12 hours for 7 days. And if he cannot take Cipro, then I would give him Rocephin IV or IM once. While he is here in the ER, I would give him IV hydration so that he's able to flush out the bacteria in his system, and also recommend that he continues oral hydration as well, whatever he can tolerate, so that since he does have nausea and vomiting. I would also give him analgesics while he is here for the back pain and antiemetics to control his nausea and vomiting. Again, I would recommend maintaining oral hydration as well as IV fluids, and starting him on a diet that he can tolerate. Probably I would start him on a full liquid diet in advance as tolerated. Also advise him to follow up with his PCP when he gets discharged, and we will follow up with the urine culture and urinalysis to make sure that he's on the right antibiotics for the specimen that's growing. Recommend to follow up with yearly vaccinations. Another important thing is that patient needs to practice good genital hygiene. And my differential diagnosis for Mr. Whitley is acute cystitis, acute kidney injury, musculoskeletal back pain, renal calculi, and sexually transmitted diseases. Acute cystitis, which can lead to acute pyelonephritis in the long term left untreated. Acute kidney injury, If he has acute kidney injury causing renal failure of some sort, it can cause bacterial growth. Musculoskeletal back pain, because the patient is a firefighter, can have back pain from just normal working and extracurricular activities. Renal calculi, that can always cause acute pyelonephritis if there's a kidney stone blocking the pathway, and sexually transmitted diseases. In his scenario, I would probably order a CAT scan of the abdomen as well, just to make sure that he does not have any kidney stones or check for any abnormalities in his renal system.